Just want to make sure that you know that the Zantac tablets there.
Every year on the Isle of Wight, GPs prescribe at least £25 million of medicines. National data suggests that 50% of medicines are actually not taken as the doctor intended. That actually means for the island that £12.5 million of drugs, medicines, are wasted every single year. By waste, I mean that any medicines that are actually not used by the patient and are unrequired. The waste campaign that we're currently running is a series of messages from health professionals and patients trying to minimise the amount of waste that we actually create each year. This has been achieved by no one piece of work, but by bringing together a whole series of strands involving a whole variety of health professionals and the public. We've tried to do that through a waste campaign, posters, leaflets handed out and on display.
We have seen a gradual reduction in the amount of drugs returned. I think it's really important people understand that we want them to take the right medication at the right time for the right condition. And if they're not able to do that, then they return them to us safely. But what's more important is that if they're not taking a particular medication, for whatever reason, talk to us or talk to your doctor and don't actually get it dispensed in the first place. You can be in a situation where the doctor's asked you to take something and given you a period of time, take that for a couple of months and see how it goes on. If that solves the problem, then sometimes people will carry on taking it after that, believing that's necessary. Sometimes it's not, and sometimes you can actually stop taking it and have no ill effects whatsoever. There's been a big change in the community pharmacy contract, the way the NHS actually uses community pharmacists these days. And one of the big things about that is now you can actually come and speak to your community pharmacist on a confidential basis in a private confidential consultation area and talk about your medication, whether it works, whether it doesn't, if you're worried about side effects, and of course in terms of waste, whether you even need to take it anymore. It's completely free, the NHS pay for it, and they actually want you to use that service.
In the last 3 years, we've moved from 6.3% above national average spend on prescriptions to more than 6% below national inflation. In real terms, that means over £6 million over the 3 years have been saved for reinvestment elsewhere.